Health is so much more than just the absence of disease. It has social, economic, political, and cultural dimensions that requires good leaders who understand fully the importance of good health in nation building. This is why, in time for the May elections, the Philippine College of Physicians is hosting a presidential forum on health called What Has Health Got to Do with Everything? The group believes whoever is going to be the next president of the Philippines must have a national perspective that takes into account players in the health industry. Joining us here in the studio is Dr. Eugenio Ramos, the president of Philippine College of Physicians. Good morning, sir. Thank you very much for talking to us. Joining us here on mornings at ANC. Is this the first time you're going to hold such a forum on health?
This is the first time that the Philippine College of Physicians is hosting a forum. I think it's important that, the Philippine College of Physicians, one is 8,000 strong members, the cardiologists, the lung specialists, and all the other internal medicine subspecialists. And we thought that the campaign wasn't focusing enough on health. We haven't really heard them speak about their platform in a more fulsome way.
Yeah, they may have breezed through it in a number of forums, but most are focused on the economy and controversies and issues against each other.
Just gives the public what they want to hear. It's libreng gamot, libreng hospital.
Yes.
All the sudden.
Too general.
Yes, too general. And we have to emphasize that this cannot happen anyway. You cannot give the resources, very limited as they are. You cannot just give them away. Yes, that's right. And I think
the government has a lot of money.
And people have to understand that they also, while it is a right, health is a right of everyone, they have the responsibility as well. So I think it's important that so many other players understand their roles in healthcare.
But more about us finding out the platforms of these candidates that would involve health.
Yes.
Are you going to inform them also of a number of problems, a number of challenges that
we have limited the discussion on 4 areas.
Okay.
Basically, the first area was the issue of access and equity in health. And so we talk about the poverty and all these things that actually prevent people from receiving the health care that they deserve. Then the second one would be in terms of the efficiency of the healthcare systems of the Philippines, the quality of care that they receive. Third is also a very important one, the social dimensions, the cultural, the political dimensions that have an impact on health and the decisions that are being made. And this is where we come up with issues on population, issues on religion, issues on the reproductive health. And the fourth one we thought that we would like to focus on is the problem with the dwindling resources in terms of human resources in health. We're having problems with migration of doctors. We do have problems also with maldistribution. And we also, I think, have problems in terms of the way we train our doctors to begin with. It is not focused on what the country really needs. And I think, in a way, we have been training doctors to kind of want to go abroad. And I think that has to be addressed as well.
Okay, I understand that the last problem, and there has been a long discussion about that, but it has just been limited to just that discussion. Now, the first let's talk about access and equity. How bad is it? Just last year, prices of medicines have been lowered. There is that greater push now for generics, use of generics, and it has benefited a lot of people. But what more problems are we encountering with regard to access and equity?
Well, when the prices of some of the medications were reduced by 50%.
That's right.
Okay, so the beneficiaries were really the middle class.
That's right, yes.
The greater majority of our people actually are way below the poverty line. And
still don't have enough.
Yes. So it actually it relieves the middle class, but does not really have so much impact on the lower class. So that's a problem. The problem of quality as well. When we start, of course, getting all these generics, it's important that we need to regulate, because the problem with counterfeit and adulterated drugs become, a very, very strong, a safe drug. It's not necessarily a cheaper drug. And so we just want to make sure that that is also attended. I think
a cheaper drug doesn't necessarily mean that it's safe.
Oh, that's right. That's right. Yes. And I think it's more of how. How are you going to sustain whatever programs you have? You cannot just say, no, I will lower down the prices and I will provide you with...
Give us specifics.
Yes.
Yeah.
How are you going to sustain it?
Yes.
How are you going to sustain it? And it's going to be difficult. And so you need... we liken the president or the next president to be an orchestra conductor. In other words, you know, there are players that are important in healthcare. One of them, of course, would be in terms of the pharmaceutical companies. You know, they have a role to play, and we cannot just forever, kind of just tell them that they have to grow. They have to grow. So it's important. The policy and legislators, policymakers and the legislators, they kind of just do things that are popular. I think it's important that they need to come up with policies and laws that are really necessary, you know? But they are limited by the fact that they cannot do anything that is not popular. The other one would be in terms of the funders of healthcare, basically the HMOs, the PhilHealth.
Right.
You know, they are also driven by their agenda in terms of trying to keep the cost low. The doctors, those are the providers, you know, they have other issues as well. They are so focused on technology, and a lot of them are leaving the country. And so we have a maldistribution where we have a lot of doctors here in Manila, for instance, and a lot, more than 50%, in fact, and a lot of our provinces are without doctors. And the most important one would be the fifth layer would be the beneficiaries, which is basically us, the public, you know, always expecting things that are supposed to be free. Okay, but without the responsibility. I think people have to have responsibility and accountability for their health.
What kind of responsibility?
Well, you know,
taking care of themselves.
Taking care of themselves. Yes, taking care of themselves. You have, you know, in other countries you have people blaming the government for the cancer that they have. Because they've been smoking cigarettes, and that, you know,
and they're saying that you should have stopped selling tobacco and the ads.
That's the kind of loss of accountability that I'm talking about. So what is the president going to do? What we would like to listen or hear from our presidential candidates is, how are you now going to orchestrate this? These are all the players in healthcare. And it is not like just looking at the beneficiaries and say, I promise you free medicines, you know. I have to tell them and make them conform themselves in terms of, you know, you have responsibility. This is not just about that. You know, I cannot just keep on giving you the things that you like, you know. The pharmaceutical companies, you know, it's not going to be profit all the time.
That's right.
You know, and you know, you also have to behave.
But there has to be some sort of balancing act for the government there, because the pharmaceutical companies, if you stifle their growth too much, they may leave and affect the economy. But you still need them.
We need them. We need research,
development.
That's right. And then you have the funders, you know, the HMOs. You know, if you have an HMO, we don't have problems with HMOs, and the coverage, the PhilHealth coverage, for instance, is not really that satisfactory, right? And so they're also trying to minimize cost. So in other words, you know, the things that may be necessary in the treatment or in the diagnosis of a patient's disease is kind of limited because, you know, we only have so much allocated for you.
Okay. You mentioned the challenge a while ago, the social, cultural, and political dimension of all of this. How is it going to be, what do you call this, asked from the candidate? Well, the most, well, not most important, but one thing that people will be waiting for is, again, this will be brought up on reproductive health.
Reproductive health. Well, you know, Philippines is one of the most, problematic in terms of maternal death. The infant mortality rate seems to have been improving over time, but the maternal mortality rate is a problem. And so, you know, there are pros and cons. There are the church, for instance, is very, very strong against the reproductive health bill. A lot of us in the medical profession are saying, you know, it is important that you know, this bill is passed. It's important that people are made. Are given the choice. It's important that people are educated about certain things. So, you know, how is the presidential candidate going to resolve this? Because we have a feeling that some of the candidates are afraid to take on, you know.
Right. Precisely my question. Are you going to squeeze out a definite answer from these
Yes,
candidates.
we will.
That's what we want to know.
We would like to see a candidate that who can actually be very, very brave. I think some of them have been quite candid about where they stand, but we also have seen some people who are trying to weed themselves out. So we are going to ask them.
Okay. The forum will start at 6 p.m. and it's going to be held at
the Barcelona Auditorium. At the Barcelona Auditorium, the 6th floor of the Medical City, along Ortigas Avenue. I think everyone knows where the Medical City is. Yes.
It's along Ortigas, yes. And the title for the forum is What Has Health Got to Do with Everything? Dr. Eugenio Ramos, the President of the Philippine College of Physicians. Thank you very much, sir.
Thank you very much
this morning.
Thank you.